I accepted.
Okay. Hi, what can I do for you today?
Well, I'm doing some research on pulmonary hypertension.
Okay,
I'm looking to get a little more information and a little guidance in my search.
absolutely. And what are the purposes of this search? Are you treating a patient with pulmonary hypertension?
Now I'm just looking at sort of just some general research in
Okay.
terms of, sort of have I identified any causes of it? What are some of the treatments for it? And how do the treatments vary in sort of urban settings where there's probably more hospitals and access to services versus rural areas?
Okay. And are you primarily a researcher or are you a clinician? Are you a doc or a nurse?
I'm a medical student.
Okay. And is this part of a report?
Yes, it is for one of my
Okay.
classes on in pulmonology.
All right. Is this like on a deadline kind of thing? You need it
It
this
is the
weekend?
deadline because it is class, but I have over 6 weeks till the deadline. So
Oh, see, you
there's
got
no
started
huge
early.
rush, but
Yeah.
within the next few weeks.
All right. Now, do you want me to pull full articles? Do you just want um, some hyperlinks to information that I found, or do you want me to show you how to do this so you can look for additional things?
Well, I'm pretty familiar with searching in general on the internet and things like that. I found a lot of things that, just sort of like the Mayo Clinic and the CDC and places like that. So I'm looking more for articles in relevant journals. Probably, I would think at least pulmonology journals. I don't know about.
Okay. And do you want just like established medical journals, or are you okay with open access journals as well?
Um, I think I'm okay with both. I assume I have a little trepidations about open access journals because I know they can sometimes be a little questionable. So I would probably prefer to stay with, the established journals. But if an open access is sort of renowned or relied upon, then that would be fine.
Okay. Um, let's see here. And is there anything else that I'm forgetting that you're needing? Pulmonary hypertension.
Well, it's kind of the one thing I would say is that there are several different ways it's sort of referred to in the
Okay.
literature. So it's also referred to, and a lot like all medical, there's a lot of acronyms for everything. But some of them, just sort of the top few ones, are APAH, which is associated pulmonary arterial hypertension.
All right.
It's There's IPAH, which is idiopathic pulmonary arterial hypertension, and then there's just PAH, which is just obviously pulmonary arterial hypertension, and PH for pulmonary hypertension.
Okay. And these are all referring to hypertension or various aspects of the disease itself, because I know idiopathic could be different from the arterial.
Yeah, exactly. So this is yeah, it's all related to hypo or high pressure in the high blood pressure in the lungs. So it's versus, yeah, it's whether it's idiopathic through some genetic reason or if it's secondary to some other cause.
Okay. So the inclusion of idiopathic wouldn't negate just because it's not the broad general pulmonary hypertension. It's okay to get specific.
Correct. And I believe from the brief research I've done that the idiopathic tends to have different treatments
Okay.
than the secondary causes, but I'm not really sure why or what those treatments are.
No, that's good because that gives a broader range of things that we can include for you.
Yeah, thank you.
No problem. All right. Well, I will go ahead and get started on this. And when I know you have 6 weeks, when are you hoping to hear back?
I would like to hear back preferably within the next week, just
Okay.
because that gives me time to further explore, pull other articles, things like that.
All right. Well, then we will touch back in a week. I
Okay.
will probably reach out to you through email. And
Okay, that's fine.
all right, we'll get together then.
Okay, thank you very much.
Bye.
Bye-bye. So, are you ready for me?
I'm ready.
Okay. Well, hello. How are you?
I'm good. How are you?
I'm good, thank you. And how can I help you today?
Well, I need some information on idiopathic intracranial hypertension.
Okay. Okay. And why are you looking for this information?
Well, I'm an APP and I just switched from family practice to neurology.
Okay.
And I've got somebody coming in tomorrow morning
Okay.
and I've never treated this condition. So I need some information about it.
Okay. So you're primarily looking for treatment information?
Yeah, I'm looking for
Sure.
what the frontline treatment options for this are. And what the diagnostic criteria is, because I've heard that in the last 5 years they updated it.
Okay. Okay. So then I'm assuming you sort of want, material in the last 2 or 3 years, with the exception, or 5 years maybe back, since you want the latest criteria.
Yeah, they did a study in the 70s
Okay.
that they base dosing on medications on, but I'm hoping for more updated information to see if they've made changes to the dosing
Okay.
suggestions or what. A lot can happen, and
Yeah. No. Yeah. Medicine advances really quickly. So I'll
right.
just look for all treatment options that they talk about in the diagnostic criteria for that. Outside of that 70s study you found, have you found anything else?
Not really. It's pretty vague. A lot
Okay.
of the information that I'm finding is fairly repetitive, and it's mostly from sources like John Hopkins and the National Institute of Health in England.
Oh, okay. And so are you looking for journal articles, as
Journal
opposed
articles would be preferable.
okay. And is there any type of specialty you want in? Like, do you care where, like, type of medical specialty you want me to pull it from at all?
Probably from a neurological
No.
angle rather than general practice.
Okay. And I assume do you need the articles in English or Canadian
Yes,
language articles? Okay. And I assume since this patient's coming tomorrow, you need this information today.
as soon as you can get it to me.
Okay. As soon as possible. Okay. And is there anything you don't want me to go beyond just the diagnostic criteria, correct?
Just
Or are they
diagnostic
set treatments?
and
You don't
treatments.
care about survival rates, anything like that. You're just
Let me see maybe the main morbidity.
okay. Okay. So I think that will probably help me get started on this. And just to recap, so it's idiopathic intracranial hypertension. Do you know if it's known by any other name or
Yeah, they
acronym?
used to call it pseudotumor cerebri.
Tumor cerebra?
Cerebri.
Cerebri, okay.
Yeah.
Okay, and okay, I think I have what I need to get started. Is the best way to get this information to you through email? Or
Probably. Yeah.
okay. And do you need me to send you a heads up text that I've found it and send it to you, or will you get your email right away?
I'll just keep an eye on my email.
Okay. All right. Is there anything else you need me to know about the research?
No, I think we're good.
Okay, then I will look for the results and get back to you within the next couple of hours.
Well, I look forward to your email.
Well, thank you very much. All
Thank
right,
you.
have a good day.
You too.
Bye-bye.